I'm Dr. Athikho, presently serving as consultant in Eden Medical Center in Department of Palliative Care and Geriatric Medicine. I'm basically trained in family medicine and later on move on to geriatric and palliative medicine. Currently, I'm working as a consultant in geriatric and palliative care medicine. So today I wanted to talk about International Day of Older Person. In 1988, the US declared World Senior Citizen Day on 21st August to celebrate and appreciate the senior citizen. This was followed by the United Nations. They decided to declared the 1st October as the International Day of Older Person and started in 1990. This was celebrated especially to commemorate the contribution of the elderly person, older adult, and then to see to their challenges that the elderly face, particularly the changes and difficulty in aging, medical challenges and biomedical solution. So the world is aging. It has been projected that the older adult is increasing. By 2050, the world is expected to have 17% of population by older adult. By older adult means 60 years and above. In some country they put it as 60 years. In other country they put it as 65 years. Under this older adult, they also further sub-classified as 60 to 75 and 75 to 85 and 80 and above and 100. They said young, old, octogenarian and centurion. So in India also by 2050 we are expected to have 20.8% of population by older adult, and we are expected to have around 347 million older adult in our country. So with this in mind, WHO, the World Health Organization, has declared and adopted 2021 to 2030 as the decade of healthy aging. So they take the motto of aging with dignity, and to improve the life of older adults, their families, the community they live in, adopting various themes as healthy environment, age-friendly environment, prevention of abuse of older adult, integrated care, integrated long-term care, and integrated care of older person. So this is important because older adults are different than adult.
So doctor, what is your role and experience when it comes to the elderly people in our society?
As I involved in the care of elderly, the elderly, they are different from young adult. So we focus on the particular health issue that is facing in the elderly. The elderly, they are different in saying that they have so many changes and they need special attention. But it is said that not everybody age the same way. So they said aging is not homogeneous, and older adult can be active and functional to the last stage of their life. So with this, they have identified the common changes that can happen in elderly and enhance their capacity, repair if necessary, treat and prevent, which is deleterious to the elderly people, especially light from the vision. They started having visual vision problem. Cataract is very common, and they have got oral dental problem. They started losing their taste bud, their teeth, and then the absorption capacity of their intestine. So they are prone to malnutrition. They also are prone to have heart related problem, stroke problem, diabetes, kidney disease, bone problem, lungs diseases like asthma, chronic obstructive pulmonary disease COPD, and people with 65 years and above, they have significant decrease in their adaptability and the immunity.
So, doctor, what are the most common health challenges faced by the elderly people in our state?
The common health problem and issues that faced by our elderly in our state are high BP, diabetes, lungs problem like chronic obstructive pulmonary disease, bronchial asthma, and general weakness, or they call it frailty. They also are prone to stroke and heart diseases, and some specific diseases which are prone to the elderly. They are acute confusion called delirium, and depression or dementia, or in other way they call it memory issue. Dementia can be by Alzheimer's disease, vascular dementia, dementia of frontotemporal dementia, and other various causes. Anxiety and depression are also common in elderly. Fall and fall related injury like fracture are common due to decrease in bone density called osteoporosis. They are also prone to have joint related problem and weakness due to osteoarthritis, and they also have got movement problem like Parkinson disease, which they have great difficulty in movement and walking. They are also prone to nutritional deficiency, as I already explained that due to changes in their dexterity, fine dexterity, the changes in their intestinal tract. They are also prone to constipation. They are prone to pneumonia due to decreased immunity. They are also prone to urine related, sometimes incontinence means like uncontrolled way that they pass out, and then sometimes obstruction. So these are the common specific health related problem faced by our elderly people.
So, doctor, you said depression, right? Depression and anxiety at old
Yes.
age. So, is it different from the normal depression and anxiety, or?
Yes, depression, they there is a specific depression called late life depression, or also elderly people, they are prone to depression due to the various challenges, the difficulty they face. Could it be health related, or could it be social related, like they have faced so many losses, grief. Also they face social problem, and then they themselves they develop, and then they have lost so many functional capacity, so they are prone to develop depression. The elderly, they will not express that they are feeling sad and that they are depressed, but we have specific tool to inquire about their depression. Hardly they will admit to depression, but using that tool, if we manage them, they get significant improvement and perform better. Anxiety is also common.
Do they show signs?
Anxiety signs and symptoms, they are breathless, worried about for multiple things which they cannot pinpoint out, and then are associated with multiple non-specific symptoms like pain, breathing difficulty, sleeping difficulty, unable to focus, unable to relax, and indecision, decisive, and then irritability, and not able to focus in things that which they are doing, and then they become more and more irritable and loss of focus in anxiety. They are aware of it, but they cannot correct it, and then adjust that to it.
Elderly people suffer from chronic pain and terminal illness. So, how does palliative care improve their quality of life?
Okay. Palliative care is mainly concerned with pain management, chronic pain management, and good symptom control when the disease is difficult or no longer a cure for it. So good symptomatic control and pain management is a part of it. So chronic pain, elderly people, they have got usually the chronic pain, multiple pain, like low back ache, knee pain, or other multiple pain, or many of the elderly, they may have cancer as well. So pain management improve quality of life, and then help them to spend their last part of their life with dignity. The palliative care are meticulously assess their pain pattern, and then made a proper diagnosis, and then give the right treatment, and then start the medicine combined with other support, making the elderly people comfortable, and then pay attention to their detailed concern. So palliative care, especially for the elderly, can be at their home, at the choice of their place, their the place of their choice. Home is the ideal place. So we involve giving good pain medication, starting from low dose, start low, go slow, so that they will not be prone to the unwanted effect of the medicine. So, and then also the other remedy which can be relieving to them, like physiotherapy or other massage, they call it like music therapy, art therapy, or touch therapy, or anything that which may relieve the pain to the elderly. So, and then once their symptoms are taken good care, we talk to the elderly and ask about their preferences, and then if they have any wishes, and then seek information if they wanted to be treated at home, or also the place of treatment when they are getting very serious and that they are not longer able to take decision for themselves. So we seek their preferences in advance.
So, what role should families and communities play for those elderly people?
As children or adults, taking care of the elderly, caring for people who have cared us when we need their care. So this is one of the noble care, that which noble thing that which we can do to our aging parents. In that way, our country and we are preparing how to include elderly people in the general care system and specially focus on them. That is why India as a whole, they have started national program for care of elderly people in 2010, and then now we are in the midway. So under this, training of the doctor, training of the nurses, training of the informal worker, specifically focused for caring of the elderly. And then the government also has made a provision to focus on elderly care, especially at the district level, and reserve some bed for the demarcated for the elderly, and then conduct OPD, outpatient department, specially focusing on the elderly. And they also focus on care given at home, and also supported and then encourage all building of old age home or hospice, which we call it. Now this here in elderly care, in hospice or hospital or wherever at home, we approach with a system called 4M approach. 1M stand for most matter the most, which means elderly people, they have multiple problem, so which can be caused by multiple problems, or a problem which is causing and leading to another problem. So we pay attention to it and find out and ask the elderly which is concerning them the most, and then after that we also focus on their state of mind, their memory, their mental state issue, like their mood means, and if their mood is low, then they are depressed, and also mobility, whether the elderly is independently able to move around and perform the things that which he or she wanted to do, which we call it activity of daily living. Activity of daily living means the basic function to survive and take care of ourselves, which we identify and promote. And then finally, medicine. When it comes to using medicine, it is which is rarely required, and not avoiding multiple medicine as much as possible, and also incorporate into non-medicine. Say example, if it is joint pain, massage and daily movement, then maintaining the activity. They also say that longevity is directly proportional to the speed of your walk. So we promote lifestyle modification. And also, if the elderly has got some lifestyle problem of addiction, we encourage them to give up. So here, in care of the elderly, home care is one which is now many are preferring, and then in the developed country as well, they have started the home care for the elderly. So when we have home care, the question of home caregiver comes. Home caregiver can be formal or informal trained person in caring of the elderly. So many of them, they are informal elderly home caregiver.
So, what is your message to the society on this International Day for older people, older person?
On this International Day for older people, I would recommend and advise, based on the theme that which we have in mind, that the elderly, they are actively contributing to our society, and they are a blessing to us. And even in the Bible, they say that gray hair is a crown of glory, attained by the way of righteousness. They may not be socially and physically active, but they pronounce blessing to us, and they encourage us. So it is our turn that we need to focus on their needs and care for them as they have cared for us. As I have said, I would wanted to summarize briefly like this, that we care for them in the way that maintaining mobility and helping them to maintain their functional capacity and activity till this last part of their life, and help them to avoid and adopt unhealthy activity, and then help them to continue with the healthy activity. And also the provision of nutrition. When it comes to diet and nutrition, we have a dictum called feed the elderly 4 meals a day and 4 snacks a day, rather than large traditional infrequent meals, and give them the desired immunization and vaccine, especially influenza vaccine and pneumococcal vaccine is mandatory for all elderly. They will benefit from it. Due to lack of resources, the government has not made it mandatory, but many of the older caregiver, they have recommended, and then they have benefited from this. And then if they have got early problems, early detection of the chronic illness, and then due treatment for chronic illnesses, and then improving their nutrition and giving long-term care will be the greatest blessing, the greatest thing that which we can offer to our elderly, and enabling them to have their life to the fullest. Thank you.